Well, hello there. And today I'm going to tell you the real causes of heart disease, tangible warning symptoms that you can monitor right now that doctors don't even know to tell you. Now, that sounds a little bit grandiose. Heart disease, biggest killer in the world. Why would I know stuff that the doctors don't tell you? Well, let me start with my qualifications to be talking about this. So I spent 13 years working on the front line as a nurse. A lot of that was during my time in a coronary care ward. So I have medical experience of working with people that had serious illness, specifically heart disease. And I've trained in numerous different energy systems like Reiki, vortex healing, energetic NLP. I've done a very diverse sub training outside of the medical field. So I've got medical experience and medical training, and I've got experience in other fields where I've explored. And it is that exploration that puts me in a very unique position to give you real warning symptoms that you can check right now to see if you're at risk of these things. So let's start. Why am I even talking about this? Well, when I used to look after patients that came in with a heart attack, the thing that they all used to consistently say, or most patients, is that there were no warning symptoms. There were no warning symptoms at all. It just came at me. It came at me completely randomly, completely out of the blue. So let's just start by saying that there is absolutely a ton of warning symptoms, and people that have heart attacks are just experts at not noticing stuff that should be obvious. So let me start by saying this is an area I've fallen out with doctors. I've fallen out with doctors, surgeons, the most senior people in medicine over this. Because there's what we're taught, there's the textbook stuff that any doctor will tell you. They reel it off as though it's absolute. The things that kill you, the things that are the warning symptoms. Do you smoke? Are you hypertensive? Is there a history of heart disease in your family? And what's your diet like? All of these things, all of these things. And it's not that they're not true. They often are. But I have a slightly different slant on things, a slightly more empowered approach, and certainly a way that you can monitor the early symptoms. Now, if you've got a loved one that's at risk, well, let me just highlight a few things that I have found consistent. So the first thing is when I started exploring this alternative field, shall we say, I was still working in medicine. And I used to go in and people used to tell me it never warned, there was no warning symptoms, blah, blah, blah. I started by changing my approach and I asked a single question, which absolutely transformed my medical practice and my capacity as being an effective nurse. I used to ask people that had come in, having had a heart attack, a simple question. What has happened in your life over the last 6 months to 1 year that's caused you increased levels of stress? And I can tell you right now that there is not a single patient who's just had a heart attack that I asked that question to that they couldn't answer instantly. Instantly. So stress affects your heart, and levels of stress affect your heart, and levels of stress over periods of time. So let's look at that. Let's look at that now. People say that there was no warning. So let's move backwards. Let's take the last warning that you get. So if you're getting palpitations, or if you're getting short stabbing pains that only last a fraction of a second, but then they go, but it feels like someone's driving a needle into your heart. Well, that's the last warning symptom. Prior to that, let's go back a step. Now you've got things that doctors do tell you, your hypertension, your diabetes. These are late on stage medical symptoms that show you that accumulated stress has led to other medical illnesses. Now, here's the big two. These are the big two, folks, because this is about stress response. Stress response is designed to keep us alive. So if you're in a situation where your life is threatened, your stress response is a good thing. The trouble is that our mind hasn't learned to tell the difference between threat to our lives and us thinking ourselves into a crisis. So if somebody pisses you off, or something happened at work, or your boss said something passive aggressive that upset you, or you had a fight with your partner. All of these things cause the stress response, and they set your body up to fight or run for your life. And if you're not in that situation, you're not in a fight or run for your life. It might feel like it in certain relationship battles sometimes, but it doesn't actually do that. So what happens is you're filled with all these chemicals, and the symptoms are that your appetite goes, it comes peaks and troughs, your energy peaks and troughs, your sleep peaks and troughs. So you've now your sleep's being affected, your weight is being affected, your well-being is being affected, and this is happening on a daily basis. And if that happens accumulative over time, then you are certainly heading towards a heart attack. It's a very slow progress, but all of these things count, folks. If you're trapped in a relationship that you hate or a job that you hate, these are two very clear indicators that all is not well in your world. So they're two big indicators, folks. They're two massive ones. People that hate their job or hate their life or relationship, and they feel trapped, put ourselves in a trap in our mind where you feel you can't leave for whatever reason. Let's go back another step. You will have a really challenging relationship with at least one close family member. And we're talking mother, father, son, daughter, brother, sister. You'll have one relationship with there that's toxic and it keeps coming up constantly and you can't resolve it for whatever issue. Now, you might have cut them out of your life, but if there's still any sort of interaction, that's still stress at the back of your mind. But the real cause of heart disease, folks, and I've found this to be consistent in 100% of the cases of people that I've looked after and asked about this, is that they have a very poor relationship with themselves. Their self-talk is negative. They're saying bad things about themselves. Ultimately, the litmus test is, can you stand naked in front of a mirror and love the person that's looking back at you? And if the answer to that is no, that is the core, that is the foundation of heart disease. And I'm telling you that from speaking to hundreds, if not thousands of people that had heart attacks, folks. And I've yet to be proved otherwise by anyone that's actually had that. I'll be very happy for your comments to straighten me out on this, especially you medically bound people who've been taught to say the same thing over and over and over again. I'm going to throw it out there that stress is the biggest cause of illness, and consistent stress over time will always lead to a heart attack or a stroke or cancer for certain folks. And having been at the front line for 14 years speaking to people that had experienced that, I've yet to find a case where that wasn't the case. So there you go, slightly controversial today, folks, using my medical background to back up the stuff that I talk about with my other stuff. And if you're finding me for the first time and you want other life hacks, hints and tips to make your life easier, to make it better, then by all means, subscribe, folks. Subscribe to the channel, like this video and subscribe. And if you want more content from me of my little insights into how to make your life better, there's another video for you there. Thank you for your time, and thank you for what I'm sure will be a very lively discussion off the back of this.